A 65-year-old man comes to his physician for an annual skin exam. He enjoys hiking and spends most of his free time traveling at national parks. He reports that he has had several lesions on his face for the last few months. Physical examination shows multiple erythematous, rough-feeling lesions on the patient's forehead. Which of the following describes the most likely condition this patient has? Choice A, large melanocytes with irregular sizes and shapes. Choice B, dysplasia with atypical keratinocytes. Choice C, atypical keratinocytes with keratin pearls and dermal invasion. Choice D, linear arrangements of basophilic cells. Or choice E, accumulation of Langerhans cells. I'll wait 5 seconds and answer the question. This is a very typical description of actinic keratosis, which is a precancerous lesion believed to be caused by accumulative sun damage. Your classic vignette is going to be like a farmer or a gardener or something. They basically spend a lot of time outside. They'll mention they're sun exposed a lot, and then they'll have the skin lesion, which can be erythematous and will be either rough or quote-unquote sandpaper-like, and they will be on sun-exposed areas, so classically the forehead, the face, the ears, the arms. Now, it's pretty common for the USMLE to give you a picture of actinic keratosis, and you can try looking at those pictures and it'll be helpful as well. But oftentimes, the vignette alone can help you diagnose actinic keratosis. So actinic keratosis is an abnormality or dysplasia of the keratinocytes, so here choice B would be the correct answer. Not a lot to say there, you just kind of have to know that. You also need to know that actinic keratosis is believed to be precancerous for squamous cell carcinoma specifically, and you usually treat actinic keratosis with cryotherapy. Basically, you freeze the lesions off, and lifestyle modification, so you just tell them to avoid the sun, put on sunscreen. So let's look at some of the other answer choices here. Choice A, large melanocytes with irregular sizes and shapes. This is describing melanoma. As you can imagine, it has all kinds of irregular melanocytes on biopsy. You have irregular size and nuclei, and sometimes invades the dermis as well, of course, because it is a malignant tumor. Now, melanomas develop from nevi or moles, but of course we don't usually treat moles because most moles are just benign growths, right? So to differentiate a melanoma from a typical mole, we use the ABCDE rule, which is A for asymmetry, B for irregular borders, C for color variation, D for diameter, so the size is usually larger than 6 millimeters, and then E can stand for both elevation and evolution. So if it's abnormally elevated or if it's just changing over time a lot, then that's more indicative. Choice C, squamous cell carcinoma. As I mentioned, squamous cell carcinoma is what actinic keratosis can develop into. The gross examination is often kind of similar to actinic keratosis, but usually if they want you to differentiate it just by that alone, they'll give you an ulcerating lesion to represent the squamous cell carcinoma. But otherwise, the main way you would differentiate this from other malignant skin cancers is that it has a whole lot of scaling. I mean, if you think about it, it does make some sense. It's squamous cell, right? So that kind of intuitively makes you think about things like, oh, it might be scaly. And on biopsy, you'll see keratin pearls, which is something that happens pretty often with squamous cell carcinomas. And of course, compared to actinic keratosis, keratin pearls are one way to differentiate, and it'll be invasive as well. Choice D, basal cell carcinoma. This is often described as having a shiny or quote-unquote pearly appearance with telangiectasias in the periphery. So you'll have this kind of smooth and shiny skin lesion, and on the periphery you'll see some blood vessels. And on histology, you would see palisading arrangements of basophilic cells around tumor nests, quote unquote. Palisading is one of those vocabulary terms that some people don't quite understand. It's basically like a linear arrangement, right? Like I wrote in the answer choice here. So it's kind of like this neat arrangement of cells around an area, almost like a fence around an area. And this is used to describe a number of tumors, perhaps the most notable one being glioblastoma multiforme in the brain. I don't think it's too important for you to know the biopsy for basal cell carcinoma. But I do think you should at least have an understanding of melanoma and actinic keratosis as far as histology goes, because it's pretty intuitive, right? I mean, melanoma, it's melanocytes, and actinic keratosis is keratinocytes. And you just need to know squamous cell carcinoma on top of that has the keratin pearls and invasion. So let's move on to the final answer choice here. Choice E, accumulation of Langerhans cell. This is mostly a distractor. I mean, Langerhans cell histiocytosis wouldn't appear in an old man like this. It's almost always going to be a kid. And Langerhans cell histiocytosis, it's a rare disorder of dendritic cells. On histology, they would be bean-shaped, quote-unquote, with prominent nucleoli. But that's usually not the big high-yield part. It's the Burbeck granules that you always hear about, which are quote-unquote tennis racket-shaped. They don't always have to be tennis racket-shaped. Sometimes they're linear. And sometimes the question will give you S100 or CD1A positive. Those are things associated with Langerhans cell histiocytosis. And if they don't give you that, they will also give you the description of the lytic bone lesions. That's a very common thing with them, especially in the cranium. Anyway, it just doesn't fit at all, right? So bringing it back, you need to know what the typical vignette of an actinic keratosis would look like. Somebody who is out in the sun a lot, and then they have these scaly / rough patches on sun-exposed areas. You need to know that this comes from keratinocytes, and you need to know that this is kind of a precursor to squamous cell carcinoma. And like I said, you need to have a very basic understanding of how to differentiate this from melanoma or basal cell carcinoma. Not too difficult, I think. I hope you found this video helpful. I'll see you in the next one.